I'd like now to welcome our last speaker, Tom Naki of Healthcare Now. Tom is now coordinating the campaign to build support for H.R. 676 for Healthcare Now, his organization, which is a national organization that advocates for national health insurance on behalf of the American people with a single-payer system. Tom is a city planner by training, but he has spent most of his life working as a teacher, community organizer, and neighborhood planner. Tom?
Thanks. Glad to be here. Our Healthcare Now's job is a little different than the other folks you've heard from. Our job is to keep folks busy, keep folks doing stuff and helping to win on this issue. And we have lots of things that you can do. And there's a flyer back there on the table that's got on one side about an event on May 31st that we hope you all will come to in Princeton. And on the other side, it's a whole list of things that you can do. One of the things that we talk about is a win-win campaign, and everybody lives someplace where you have a local government. And that local government can save a lot of money behind national health insurance. So you pick your target. It can be the township council, it can be the school board, however you want to do it. You calculate the savings that will come, because we're talking about, instead of paying the premiums of private and health insurance that all employers are doing now for their city, township employees, school board employees, you pay a payroll tax that's estimated to be about 4.5%. And the savings are huge, as you will see in a minute. We have on our website a calculator sheet that helps you figure out those savings. City of Philadelphia could save $539 million. You put the information down, put together a fact sheet, and then go to your elected officials and work to get them on board. Ray mentioned how the state of New Jersey could save $2.5 billion. 1.7 of that comes from reduction in the cost of state employee health benefits. Another close to $1 billion comes from the fact that you wouldn't have to pay, the state wouldn't have to pay charity care anymore, which Catherine talked about hospitals closing. Well, that's one of the reasons, is because their reimbursements for charity, for the care they provide to the uninsured, is not adequate, so that would go away. Recession is causing all of these local governments to have a serious fiscal crisis, and the win-win campaign addresses that. The budget gap can be offset by the savings from health care if we had national health insurance. Just comparing in some of the places where they've been organizing campaigns, you can see the green being the budget shortfall from the recession, and then comparing that to the savings that could be realized through national health insurance. Pretty significant impact in terms of that recession deficit. And if you look at some big cities, it's even more profound, and the numbers are much bigger. State of New Jersey, Corzine could offset completely the $2.1 billion problem he has with the state budget if we had national health insurance. So we can use this is one tool we can use to build the political will that we need to win single payer. There's another national campaign underway, alluded to earlier also, but in the state of New Jersey, but nationally, every state legislator has been asked to sign on to H.R. 676 because of the savings that it would bring to their state government and the problems that it would help them solve. So all over the country, we have people asking their state legislators to sign on to this campaign, and when we get a few hundred of them signed on, they're going to all sign an open letter to President Obama and get an ad in Roll Call, which is a big magazine on Capitol Hill, and do other press events to try and help build the political will, again, for H.R. 676. Each one of those state legislators is asked to fill out a form such as this and send it back to the campaign that's being coordinated by State Senator Jim Furlow in Pennsylvania. We have a statewide coalition in New Jersey. It's got a bunch of organizations listed on it, and Catherine, we need to get the New Jersey Primary Care Association on there, that are all involved in organizing to win single-payer health care in New Jersey. Lots of folks engaged in this effort. And as was mentioned, we have legislation pending before the state legislature, resolutions in both the Assembly and the Senate. And then this is our flyer about the event on May 31st at Princeton, the statewide event co-sponsored by the New Jersey One Plan, One Nation Coalition and the Presbyterian Church USA. Kind of an interesting piece here. The Presbyterian Church, when they endorsed HR single payer at the national level, they actually set aside money to help do education about single payer and to get people involved in single payer. And so there's 10 regional conferences that the Presbyterian Church is co-sponsoring. One of them will be in Princeton on May 31st, Sunday afternoon. We hope all of you will come and bring folks with you. Every elected official, state level and federal in the state of New Jersey has been asked to come and account for their position on single payer. The question of political will is the one that is really the bottom line here. And just a couple of things in closing. We have won many things that were once politically not feasible, and you can name a bunch of them. Women's suffrage, civil rights, gay marriage, the right of workers to organize. All won when people said they're not feasible. And what good is a politically feasible solution if it won't work and it's not what we want?
That's right.
You heard Dr. Boylan remind us that most of the American people want single payer, and that one of the key messages that comes from physicians of a national health program is that as long as private insurance is in the mix and we have a multi-payer system, we will not save money, we will not get the benefits we need, we will not cover everyone. And we have lots of evidence from different state efforts to do healthcare reform that show us that. So it may be politically feasible to have a public option and doing what Congress is doing, but it's not going to work, and it's not what we want, so we can't support it. And finally, members of Congress must not be allowed to define political feasibility based on what the big campaign donors want. It's got to be based on what we want. We hope you all will get involved and engaged and work. We need all the help we can get to win this. Congressman Payne made that very clear. And we thank all of you who are already working your buns off to help us win national health insurance. Thank you.